Good afternoon, everyone. Sue Weldon here, and I am your host today for the Ask the Experts. I hope you're able to join us live. We have a very hot topic. It is all about increasing that pelvic floor and really strengthening it. And we have an expert here with us today. Before we get into that, I wanted to just thank all the sponsors that make this possible, and we couldn't do it without them. So our lead sponsor for the education series is West Pharmaceutical. Also, our supporting sponsors are Daiichi Sankyo, Merck, and GSK. We are so honored to have their support because this year alone, we have brought you over 26 live events and have an amazing Her library that keeps everything up and rolling just so our audience can just be able to get the information that's needed, and even if they miss the live stream. So I'm going to give a little bit of an introduction to our expert today, and she is actually very dear to my heart, Alison Donley. She has been a part of the Unite for Her founding team. You know, we had her as an advisor in yoga, and, you know, her expertise in the field of yoga is just extraordinary. I am always learning. I'm a constant learner student when I'm around Alison, and I'm honored that we have her here today. She has 24 years at Westchester University in the kinesiology department. She helped create the Center for Meditative Studies, was an advisor for the Sustainable Living Yoga Club at Westchester, and she leads a teacher training at Westchester University as well. So today, you're in for a treat. I am going to bring Alison on board. So Alison, let me grab you up in a couple seconds. And there we are. Hi, Al.
You are near and dear to my heart as well, Sue.
Oh, well, yeah. We're lucky we get to do this together, right?
Absolutely.
I'll share a little bit of a personal story. Alison and I were teammates back in the day in the 80s on the gymnastics team. That's how I met this extraordinary woman, and she has been by my side for every year afterwards. So Alison, thanks for sharing everything today with our audience. It is such a good topic. I know personally, I came to you with this topic, you know, I'm trying to strengthening that pelvic floor for so many different reasons. And I'm so glad that you are here today to sort of give us some really good, you know, level setting on what we can do to get started, right? Because sometimes it might feel a little bit overwhelming. So we have some questions that have been coming from the audience. Know that, you know, if you have any questions, we're live. So please just put them in the chat, and I'm going to be following them. I actually have my team watching too on Facebook, and we'll have this wonderful interactive conversation today with Alison. So Alison, our first one, just to get started, is what are some of the common problems that you see associated with a weak pelvic floor?
Well, because the pelvic floor muscles support the bladder, the bowels, the uterus, when those muscles get weaker, it can actually lead to pelvic floor dysfunction, which 1 out of every 3 women experiences in a lifetime. We just don't talk about it. But all kinds of issues can come from having a weakened pelvic floor, easily passing gas, having a difficult time, like incontinence of the bladder and the bowel, less pleasure sexually, sexual dysfunction from weakened pelvic floor. But when the weakened pelvic floor muscles become dysfunctional, pelvic floor dysfunction, that's when some really, you know, you're afraid to laugh. Yeah. Your sneeze is unpredictable, that kind of thing. And just, it can lead to organ prolapse, which is when the bladder will actually lose its structure, or its, the muscles around the bladder will be so weak that the bladder will actually start to descend and press against the vaginal walls, which everyone can, I'm sure, imagine all the problems that would happen as a result of that. You know, you need a surgery.
Yeah. 1 in 3, Alison. Wow. That's a lot, right? And is it over a certain age, Al, that you start to see this happening, or is it just 1 in 3 adults?
Well, obviously things will affect your pelvic floor stability or lack of, you know, childbirth, pregnancy. Pregnancy childbirth, or there are obvious ones, obesity, how you sit, how often you sit, your posture. So while some of these things will get worse as we age, some of these things are showing up in younger and younger women.
Okay.
Because of posture issues, I would say. Yeah. And the incredible symbiotic relationship between the breast and the pelvic floor, which we'll get to with it, I'm sure.
Yeah. Yeah, it's good to know. I know you just, putting all that together and understanding there are some things that you can do at any age, and how you can sort of guide us through that today would be fantastic, Alison. You talked about like urinary incontinence. What are the different types of urinary incontinence?
Well, depending on what resource you go to, they are often called different things, but in looking at Harvard Health, I found that they basically refer to 6 different types of incontinence. Stress incontinence, which is when you have a lot of pressure on the pelvic floor muscles. During pregnancy, it's when a lot of women first start experiencing stress incontinence. But overweight and obesity can cause distress incontinence, heavy lifting, that kind of thing. But it's where you have this very strong urge to urinate because you have a lot of pressure that's pushing down. There's urge incontinence, which the bladder muscles become overactive. Sometimes it's referred to as overactive bladder, and it makes it very hard for you can lose small amounts of urine on the way into the toilet. And then there's mixed incontinence, which is the wonderful gift of having both of those things at the same time. A lot of women end up with mixed incontinence. I've had 2 very large babies, so I really, what I'm an expert in is yoga and how to put yoga with these things, these issues in life. I'm an expert at being a human being with a pelvic floor, as far as pelvic floor anatomy, not an expert at all that, but I have learned what I need to know to be the best yoga teacher I can be. So mixed incontinence, there's overflow incontinence, and that's when you feel like your bladder is never really emptying fully. And you might go to the bathroom quite often, but not really have much in the way of urination. Sometimes this happens because there's too much pressure on the sphincters, the urethral sphincter, which I gotta be honest, I love the word sphincter. And there are more different sphincters in the human body. It's not just the one we always think about, but when there's a lot of pressure there, it can actually cause the like an overflow or an overfilling of the bladder that you might not even feel, but then the urethra kind of lets loose and overflow incontinence, that's called. Another one is called functional incontinence, and that's one that usually happens as a result of a disease process, surgical procedure, that kind of thing. There's reflex incontinence, and that's when it often comes from a neurological condition. So reflex incontinence usually appears in people with serious neurological conditions. It also can happen with people with diabetes and heart disease. And then there are 2 things that are not usually considered in the categories, but nocturnal incontinence. Some of you may have experienced that. And for a lot of people, the bladder becomes overactive at night. And there are all kinds of psychological things too with this. Like if you're really, really worried and stressed about something at night, you might be more likely to get up to go to the bathroom quite often. And then there's something called PVD, which is post-void dripping, or post-void dribble. It's self-explanatory. But the big thing with that is to calm down, relax, take your time when you go to the bathroom. Try not to rush through going to the bathroom, because for many women, women may find it easier to avoid more fully it with different positioning on the toilet.
Okay.
Like you think you're done. Am I really done? Let me kind of lean this way. Let me relax a little bit at the end of going to the bathroom so that you might, get all of that out and not have to dribble. Yeah.
So many different kinds, and just to be aware, right? Like we always talk about knowing your body, right? Knowing what's normal, knowing what's a change, write it down, because I think we have such a fast-paced life anymore, and we just think, oh, no big deal. And then all of a sudden you're just ignoring some of these signs. So the fact that you went through so many different types of urinary incontinence, it just allows us to like, okay, let's make a note down just so that we can address it earlier, sooner than later. What are the health benefits, Al, of developing and maintaining a strong pelvic floor?
Well, obviously, not having to worry about all of that awful stuff.
Totally.
But on top of that, to just improve your overall quality of life, improving your sexual function, improving sexual pleasure, overall quality of life, of course, is going to improve because you don't have these issues that are, bogging you down. I know during pregnancy, if I was going to go anywhere, I needed to know within 30 seconds of being in that place where the bathroom was. And probably most women who are on this are like, yeah, that was me. But yeah, definitely improving overall quality of life. And one thing that a lot of times I think people don't relate to this is your posture. Improving your pelvic floor, the strength of your pelvic floor so you can avoid pelvic floor dysfunction, which again, 1 in every 3 women over a lifetime will experience. And I said this yesterday in the presentation, but over the years, more and more young women at Westchester, we have a class, Yoga 2, where everyone had to pick a topic of interest that was relevant to them in their lives, to do significant, scholarly research on, find peer-reviewed studies, and then whittle that research down into a 5 to 10 minute presentation to give to their classmates. And a lot of young women chose pelvic floor, health of the pelvic floor. At that age, maybe many of them were interested in how it might improve their sexual function, but I thought it was really wonderful that these young women were wanting to know about that now, because gosh,
Totally.
What a difference that would have made.
Of anything. Yeah. I don't remember even having, that thought wasn't even in my mind in my 20s.
No.
Yeah, that's really actually positive, right?
Yeah, really positive. Because some of those, young people who learn about that early are going to really avoid some of these bigger issues.
Yeah, totally. You talked a little bit.
Young people too, I might say. Sorry.
Say that again.
Posture with young people.
I was just going to talk to you about that. So, because their heads are down, right? Because you're looking at your phone all the time, and I mean, we see it. We see it. I think you called it tilted head syndrome. Is that what you were calling it?
Forward head syndrome.
Forward head. Yeah. Because of the cell phone and just the way that we're sort of evolving in this digital age. But tell me a little bit about the posture, and how that affects our pelvis, because you were our pelvic floor.
Yeah. Well, I will say, going back to, teaching for 24 years, I felt like I had a front row view of what was happening with people's posture. In 24 years, it got bad to the point where, in the beginning of my teaching in the late 90s, there would be very few students who had forward head syndrome or forward head posture. To, flash to 2022, it was a given that more than half the kids were going to have postural issues. And I really do pin that on, our overuse of electronics and especially cell phones. So yes, poor posture affects a whole bunch of things, because if you think of your spine, well, I'm going to pull out one of my props.
I'm going to make you full screen now, Al, because we want to make sure we see your friend here.
Okay. So this is my friend Pelvis Costello. And I took a leg off for ease of talking about this, but our natural posture, we have these curves in our spine, two lordotic curves at the cervical spine at the lower lumbar. And if we are often looking down or sitting at the computer or pushing a grocery cart or driving a car, all these things that are forward in modern society, we are forward way too often. Then this natural curve in the cervical spine might go away a bit, so this will flatten out. So posture is really dramatically affected, and the pelvic floor is dramatically affected by posture because it's like human Jenga. Everything's connected, and as soon as you take one of those blocks when you're playing Jenga and move it off the side, it's going to affect everything down the line. So the same is true of your posture. When you are sitting or standing or walking with poor posture and the rib cage is compressed all the time, not only are you messing with the pelvic floor, you're messing with the structure of the feet, how the feet hit the floor. Everything up the kinetic chain is affected by our posture. And there's some other things that are affected: digestion, respiration. I mean, all of these health issues that are related to stress I try to, in the nicest way possible, point out to people that sometimes, well, let's work on your breathing because it doesn't look like you're actually breathing very well, you know, without making somebody feel, oh my gosh, I wasn't breathing. But when we can catch ourselves and realize we are breathing mostly here, we're only breathing clavicular breath up in here. We are not engaging our pelvic floor at all. I mean, it's really not doing much. So the relationship between the breath and the pelvic floor is a symbiotic one. They are antagonists, actually. So I'll do some, if you give some little breath, so maybe people can feel the relationship to the pelvic floor. So I am going to move back a little. Okay, so I invite everybody to take your hand and make a little soft fist. I'm, by the way, freezing cold, so I'm shivering a little bit.
Yeah, fall is here.
Okay. So taking your hand, soft fist, putting it right about here, which is where your diaphragm lives in there. The diaphragm is a muscle sheath that separates your upper and lower body, your organs. And when you breathe in, the diaphragm moves down and it spreads out. So here's what my hand is doing as I'm moving it down. And when you breathe out, it comes back up into its resting shape. So I'm going to encourage you to sit up really, really tall, plant your feet firmly into the floor, and preferably you'll be in a chair that is one that your knees will be down below your navel line. You're sitting in a fluffy chair where your knees are up above your navel. Try to reposition if you can. Okay. Put our pretend diaphragm here. Sit up nice and tall. And I invite you to close your eyes so you can really feel this. As you breathe in, move your thumb down along the line of your spine and start to spread your fingers and thumb open. And as you breathe out, pull it back up and let it come to its resting shape. And keep going, breathing in, spreading out. Breathing out and coming back. Breathing in, it's going down and it's spreading out. Breathing out, it's coming back up into its resting shape. Now feel if you can connect the sensation to the pelvic floor. When you are breathing in and the diaphragm is going down, spreading out, you're feeling a relaxation or spreading out of the pelvic floor. As the diaphragm is moving back up on your exhale, you might feel a little bit of a lift to the pelvic floor. Just keep that going. I'm going to keep my hand going. You keep your hand going, but really try to connect the sensation to the pelvic floor. Diaphragm's going down on your inhale. Pelvic floor muscles are being compressed, relaxing. Diaphragm's moving back up on your exhale. Pelvic floor muscles are lifting. Keep it going. I'm going to get another prop. Okay, so I'm going to invite you to open your eyes now. You may have felt some sensation, some connection between the two. Could you?
Yeah, totally.
Yeah. I mean, gosh, wouldn't that have been great if we would have learned that early on? Like, wow, that's all connected. And that's one of the themes in yoga, therapeutic yoga, especially because in therapeutic yoga, your instructor is working individually with you. You know, what is your story? What are the kind of puzzle pieces that will help us put a wellness puzzle together for you? But the connection is intense between everything in our body. So I put a little balled up tissue on a bunch of tissue paper. I'm kind of the MacGyver of props sometimes, but I'm sticking it inside of, this is Frank, inside of his hip and pelvis. So here's the diaphragm up here. When you breathe in, it's going down, it's spreading out, and it's pushing and spreading those pelvic floor muscles out. When you breathe out, it's coming back up, but it's lifting them a little. Okay?
Yep.
What's happening inside your body? Isn't that miraculous?
No, I wish we could see all that, you know?
Yeah. And there are some great 3D things with some of the anatomy, you know, places you might find reputable anatomy sites. You might find some really cool 3D imagery of that.
Yeah. Yeah. If you ever find any, send them our way. I will put it out to our community. It just allows you to visually take the exercise and understand what it's doing, right?
Yeah.
And I know I'm such a visual learner, so I appreciate all of your MacGyver props. Thank you.
Yeah. And I will just show too, like if somebody's posture is really poor, and the head is forward, that's making like a posterior tilt.
Yeah.
Pelvis this way. So think about how that's affecting the pelvic floor structure at the bottom, like the perineum, the floor that's holding everything up.
Yep.
If your posture is poor, it's putting that at a funky angle. So it's stretching some areas and tightening some other areas.
Yeah.
So
Yeah.
then throw into it what most women who wear heels have, which is an anterior. This is a posterior tilt. This is an anterior tilt.
Yeah.
Okay? And that anterior tilt's tugging on things, you know, it's just not a natural way for the hip and pelvis to sit. So you think of your hip and your pelvis as your keystone bone. Think of it like Pennsylvania's keystone state that holds other ones together. Your hip and pelvis are your keystone bone, holding your upper body and lower body together along with a bunch of muscles. So but underneath there, the pelvic floor perineum, actually, there's so many muscles.
Yeah.
Going on in there, but basic, try to keep this basic. The perineum, there's a diamond shape of muscles that attach at the pubis symphysis, right here, the pubic bone, where it comes together into a symphony, into a symphysis.
Yep.
The pubic bone, the ischial tuberosities, the bones you sit on. Okay. So pubis, all the way back to the coccyx or tailbone muscles in the pelvic floor are like a hammock attached from the pubic bone in the front to the tailbone in the back, and then muscles attach also outward into the ischial tuberosities, the bones that you can feel when you go side to side.
Yep.
So keeping the hip and pelvis in a good position completely affects that diamond shape of muscles down there.
Yeah. Alison, we're going to all have you in our ear. I just want to continue to sit the way I'm sitting right now and breathing the way I'm breathing right now, because I have totally stepped up my game because of all those cues. So Thank you for that. So that breathing assist and that awareness to strengthen the pelvic floor is just going to, become a part of your daily routine.
Yep.
Yeah. So speaking of routines, right? So how do I develop a routine that's right for me, and how can I fit pelvic floor exercises into my day, right? So I don't want our women or our men on this, you know, this series to say, how am I going to fit that in? One more thing I'm going to have to do.
Yeah. Well, the wonderful thing is you can fit it in without anybody knowing. So you could technically be in a meeting and smiling softly, getting the tongue off the roof of the mouth is kind of like, and pay attention to the meeting, but you can create some engagement of the pelvic floor when you're doing just about anything. There are often directions or guidance to stop a flow of urine when you're going to the bathroom, like take time to actually stop that flow of urine. But because yoga practices are actually guided by Ayurveda, which is it's the oldest science of life. It's fascinating, but one of the rules is it depends. So it's really important to know if you have really tight spastic muscles in your pelvic floor, doing some stopping the flow of urine every time you go to the toilet might not be the right thing for you. So getting some guidance from your doctor can be quite helpful. If you're really concerned about possibly having pelvic floor dysfunction, going to a urologist to have that assessed is probably a good idea. They will actually assess the strength of those muscles by going internally, but there is a way that you can do it by taking your fingers. I'm going to invite everybody right now to find your navel, your belly button, and then put your pointer fingers there, but then drop the other 3 fingers down below your navel. Then go ahead and move your pointer fingers to where your pinkies were. Okay, now that's an area where when you're feeling your deep breathing, you might feel some movement of those fingers. So when you breathe in and the pelvic floor is being kind of pressed down, it's relaxing a little. You might sense some movement in here. And then when you're breathing out and it's moving back up, that's when the pelvic floor is lifting. You might feel the fingers are coming in a little. So someone who has no feeling of that, by the way, if that was you, don't be stressed out. You can improve it, and it would really help to work with somebody individually on it to develop that awareness of that area and the sensation. If you've lost the sensation, it can come back. In most cases, it'll come back, so try not to worry if you're not feeling that. But working individually with somebody is a great idea. But if somebody is already, well, I already feel that, then a therapeutic yoga application might be something called Mula Bandha, which is a root muscle lock or lift. Uddiyana Bandha, which is the navel pulling in and up toward the spine. I'm going to do an Uddiyana Bandha to show you. I'm going to pretend like I'm going to try to breathe in, but I'm holding my nose softly. Now, I just popped my ear that was closed a little bit. So that's making my ribs pop out. So when the ribs are puffed out, then the navel can really pull in. Okay, when the navel's really, really pulling in like that, you can lift almost like you're lifting from the center of the pelvic floor. So a lot of times there's this urge to squeeze the glutes, to squeeze the buttocks when trying to feel the pelvic floor, but those are separate muscles, so we want to really try to isolate. So let's isolate just for a moment in some key areas. I'm going to encourage you to feel where your pubic bone is. You might even palpate that, like if you're not around a bunch of people and feel okay about it, you can push in and feel where this.
The bone is, yeah.
Yeah.
Mm-hmm.
symphysis is right up here. And then you're going to pretend like you're attaching the front end of a hammock to that pubis. Okay, if you've ever tied a hammock to a tree, or even if you never have, you can probably imagine it. Now you're going to tighten the strings a little bit, like you're trying to stop the flow of urine. You might hold that for a couple breaths, but totally notice your breath. And then release it. Okay, let's go to another key area. Go back to your coccyx or tailbone. Pretend like that's where you're tying the back end of the hammock. Okay, now tighten the strings, pull on the ropes, however you want to visualize it, as if you're trying to stop passage of gas without tightening your buttocks. Maybe hold that for a few breaths. And then release it. And you might not be able to hold it for even one breath yet. It's okay. I swear it will get better with practice.
That's the hard thing when you're trying not to use the larger muscles, like your buttocks to squeeze, right?
Absolutely. Isolating these pelvic floor muscles is challenging if you've lost a lot of feeling in that area, but that's where you can simplify it dramatically by just breathing better. Like paying attention to your breath throughout the day and making sure you're taking nice deep breaths and doing diaphragmatic breathing that is doing the work for you in the pelvic floor.
Yeah.
The third key area is in the very center of that diamond-shaped bunch of muscles. Okay, I'm going to refer to it as the perineum. Right in the center, that feeling of lifting up, as if lifting from the cervix for a woman. Years ago, I'm going to grab another prop. I had a yoga teacher who was trying to encourage us to feel the lifting from the pelvic floor, which is in yoga speak Mula Bandha. And he took a Kleenex, a tissue, and he put it right below his fingers like this, and he just really gently went like this and lifted this tissue right up. And I remember looking at him thinking, I have no idea what he's talking about. And what is wrong with him? And over the years, as I started to really be able to isolate that lift through the pelvic floor, and especially in the middle, I was like, that is exactly what he was talking about. It's not this, where everything around it is gripping and nothing can go up. There's a subtle feeling of a lift from the center. So we don't do clenching when we're doing these exercises. The difference between gross or clenching and subtle, clenching might be like 100% you're doing, you're squeezing really tight. We're going for about 20%, very subtle. And you'll get stronger and stronger to the point where you're going to feel so much more as you're doing the exercises. And rather than rushing to the doctor to have an internal, exam to see how well you're doing, you might do a pre-test with your fingers down below your navel at that spot. And then feel what you feel. And then in a couple weeks of dedicated practice, do that little self-assessment again, and all of a sudden, wow, I feel that now. That is motivation to keep going.
Nice. I love that visual with the tissue. Like that's such a good, small movement that you can picture all the different, cues that you gave us of the floor. Thank you, Alison. That's great. Okay. So we talked about, are there any contraindications for the pelvic floor in strengthening exercises?
Yeah, 100%. So again, going back to the Ayurvedic principle, it depends. Like, hey, will this help me? Well, it depends. And that is a huge thing with knowing which exercises might be right for you. So for someone who's having spasms in the pelvic floor, they have very tight pelvic floor muscles, a doctor might prescribe non-steroidal anti-inflammatories if there's a lot of pelvic pain. Muscle relaxers are often prescribed. And I'm pretty sure that has to happen before someone can start to work on strengthening the pelvic floor. If those muscles are already spastic and tight, no amount of trying to stop a flow of urine is going to make that better until, there's some remediation of the spasms.
Okay.
So if somebody's had been radiated, if somebody's had
I was just going to ask you that. Mm-hmm.
Yeah, that's where it really matters. So again, it's like for a lot of people have this idea of yoga as you go dress up in your fancy clothes and you go do a bunch of strange looking postures in a room full of people. And I always think of that as kind of like, that's group yoga in modern society. That does happen. But therapeutic yoga is really incredibly valuable for this very thing. Like, to be able to work with somebody one-on-one and have them help you figure out how to put the puzzle together, it's really beneficial.
Yeah. Well, I can speak from experience, Hal, because you helped me, I mean, now I use it in everything I do, whether I'm working or doing yoga or riding a bike, like whatever I do, I'm always thinking about that. So that one-on-one, it just was resetting me, where I just didn't realize what could have been lost. So, and then to see the difference.
Mm-hmm.
How long, speaking of, then how long does it take to see the difference, Alison? Because I'm curious. I feel like I have to go back and get tested. I'm like, all right, I want to do that test again. Yeah. And see how I do.
Yeah. So I hope you'll let me know after you do that. But some people will report results within a couple of weeks of dedicated practice. I mean, it's like anything. You can become an armchair, armchair warrior in just about anything. You can have knowledge, but until you put it into action and make it experiential, it's not going to make much impact. So you have to really think about how you might put this in your day. And I think of trying to make it into a meditation. Meditation is a formal practice, but it defined is conscious awareness. So a couple times throughout the day, be consciously aware of what your pelvic floor is feeling like, what your breathing is feeling like, maybe in the other order. Be consciously aware of your breath throughout the day more often. And then dive into what do you feel down there as you're breathing, maybe doing some of the exercises. And as your pelvic floor starts to get a little stronger, get a little more awareness of it, you'll probably be able to hold some of the exercises longer. You'll be able to add a few more minutes of exercise in. So starting out with maybe one session a day for a week or two, then maybe add in another session, like morning, evening for a week or two, maybe even adding a third short 5 to 10 minute session. And after a few more weeks, just like anything, you don't want to start too quickly. If you were constipated, you wouldn't eat a bag of prunes. I'll just put it like that, right? If you wanted to get strong biceps, you wouldn't pick up the 100-pound dumbbell first. You have to work your way toward being able to tolerate these exercises. But I think with the little self-assessment, it's kind of interesting because some people might notice in a couple weeks, I can feel that now. Yeah. Because internally, you have the abdominal muscles, the rectus abdominis, you have the obliques that wrap, and then deep in there is transversus abdominis. And I will send you that video when I find it again, that shows on an ultrasound being performed of pelvic floor exercises. The person is receiving, and they have a blanket on them. It's totally not X-rated or anything. It's a really fascinating video where someone is having a vaginal ultrasound. You can see on the ultrasound, as the pelvic floor exercises are being performed, you can see the transversus abdominis.
Yeah. Oh, so good. Allison, we did have a question from the audience. I actually put your name in the chat, so I hope you don't mind. She asked if, she's seen a PT for her pelvic floor issues, and she wanted to know if you taught yoga classes for focusing on the pelvic floor. So I can answer that, Mary, because I've done them. And yes, she does. And she's brilliant. And like you said, you start out and you gave me, a routine to do, and then I would continue to up that routine on the amount of minutes, and then it just becomes a part of your daily routine, and graduated from Allison's classes. But yeah, so I put everything in the chat for you there, Mary. I hope that's okay, Allison. I'm thinking it is. Yeah. Awesome. Yeah, terrific. Well, thank you. Allison, it was great having you. I really appreciate you giving us attention to this such an important topic. And please know, for our audience, if there's any more questions, we do follow this feed. We follow on Facebook. We'll get right in touch with Allison and shoot her a text or an email and answer your questions. And I love that this is sitting in the yoga space today, because I do feel like it should go together. I love the therapeutic yoga and not the group yoga that we're all used to, because we all know how healing the power of yoga can be, and meditation, and this type of studying that we can become students of. So thank you so much, Al, for bringing all that to us.
Thank you for having me.
You are welcome. You are welcome. Yeah. So again, we want to thank, our digital sponsors for this event is West Pharmaceutical. They are our presenting sponsor. And we are so grateful, because we come up with incredible topics that are so forward thinking and front of mind for our community. We also, again, want to thank our supporting sponsors. That's Daiichi Sankyo and Merck and GSK. So thank you all for joining today. It was like we had a little class, Al, so I appreciate that, because, I was working at my computer, head down, right? I'm doing everything that you said. And as soon as I start listening to you, got my chest up, shoulders back, pushing down on the floor on my feet, feeling the ground beneath me. And it's just a great reminder. So thank you for making my day better, Al.
You're welcome.
All right. All right, everyone. Listen, have a great day. Please join us. Follow us along. We have a great series coming up in October already, which is so incredible that we are well into the fall. I'm feeling the fall breeze, and I love every minute of it. And I want you guys to want to join us for some more Ask the Experts speaker series. We're here to make sure that we are answering all of your questions. All righty. Have a good day.